Rock the house in. 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 Rock the house in.
Okay. Shoulder? What happened? I got hit and I fell on it funny.
Right, can I get you to sit up?
Yeah.
Alright.
Are they getting a penalty?
Yeah, they're getting a penalty.
Okay, I'm just gonna milk it a bit.
Okay. Whenever you're ready to sit up, alright? How's your head and neck feeling?
Oh, my neck and everything's fine.
That's okay, yeah. Yeah, you know where you are, and what period is it?
Second.
Second period? Okay, perfect. Who scored last?
We did.
Who are we playing?
Not real well.
Good. Okay, can I get you to sit up now? Okay, I'm just gonna take a quick feel around your shoulder, alright?
Yeah.
Okay. Okay. So what we're gonna do, do you feel comfortable in skating off the ice?
Yeah.
Okay, yeah, alright, we'll get you off the ice.
Okay.
We'll take a further evaluation in the room, okay? Adrian, how you doing? Alright. Are you okay to remove your shoulder pads right now?
Yeah.
Alright. 2, 1. That wasn't so bad now, was it? Okay, I'm just going to take a quick look at your shoulder, right? You let me know if you feel anything, okay?
Okay.
Is that still okay?
Yeah.
Good.
It's a little tender.
Yeah. Right there? Okay. I'm going to get you some ice, alright? And we'll come back, alright?
Adrian, how you doing, bud? I need you back out there. Start of the period right away. 5 minutes. Let's go.
I don't think so, Coach.
No,
What do
Coach,
you
he might have a possible AC joint separation, so his night's done.
What? What do you mean his night's done? It's the middle of a playoff game. I need him out
No,
there.
but you know what? We need to send him to the hospital for some x-rays and some other tests with some doctors just to make sure, to see what severity his injury's at and what grade that his possible separation's at.
So what does that mean? How long is he going to be out for? We're in the middle of the playoffs here.
He's out anywhere, I would say probably between 7 days and 8 weeks. But, you know what, it doesn't look too bad, so we're just going to send him away for some x-rays. I'll put a sling on him, keep the ice on, limit the damage, and we'll take him away to the hospital.
All right, Adrian, good luck with everything. I got to go.
All right.
You okay?
Yeah.
All right, I'm going to get you a sling and we'll take you to the hospital, all right?
That sounds
all right. Adrian, how you doing?
Good.
Good. You ready to take that ice off?
Yeah, sure.
All right, we're going to put a tubular sling on you right now so we can send you away to get some x-rays, okay? All right.
Oh, that's way better.
It's better? Okay, I'll leave it right. Tuck this underneath so you don't get caught on anything. Circulation's still good. Perfect. All right, well, let's go grab your jacket and we'll take you off to the hospital, okay?
The AC joint is a synovial joint that is comprised of the acromial process of the scapula and the lateral end of the clavicle. The static stabilizers of the joint are the 4 AC ligaments, superior, inferior, anterior, and posterior, along with the 2 corticoclavicular ligaments, the trapezoid and conoid, and the coracoacromial ligament. The dynamic stabilizers of the AC joint are the deltoid and trapezius muscles. The mechanism of injury for an AC injury can be a direct force to the superior aspect of the acromion, causing the acromion to be forcefully depressed while the clavicle is held in its normal position. An indirect force may also cause an injury to the AC joint by falling onto an outstretched arm or hand in an adducted position, causing the humerus to be forced upwards and driving the humeral head into the acromion. In both mechanisms, the acromion is driven away from the clavicle, placing the AC and corticoclavicular ligaments under tension, resulting in a sprain or tear. In a type 1 AC joint injury, there's a direct force to the shoulder results in a sprain of the AC ligaments. There's no disruption of the AC and CC ligaments, both are still intact, and there's no instability of the clavicle on stress test. This type of injury is usually treated conservatively through rehab. In a type 2 injury, greater force to the point of the shoulder results in a rupture of the AC ligaments. The CC ligaments are still intact, and the clavicle is unable to detect stress test. Type 2 injuries can also be treated conservatively through rehab. In a type 3 injury, there's complete disruption of both the AC and CC ligaments, but no disruption of the trapezius and deltoid fascia. Deformity is present with the clavicle appearing to be elevated due to the acromion being depressed, and the clavicle is unstable in both the horizontal and vertical planes. Pain with motion is severe. Type 3 injuries can be treated conservatively or through surgery. In a type 4 injury, the distal clavicle is posteriorly placed into the trapezius muscle and may tent the posterior skin. The AC and CC ligaments are completely disrupted and the deltoid and trapezius muscles are detached from the distal end of the clavicle. Type 4 injuries are treated surgically. A type 5 injury is a more serious form of a type 3 injury. There is disruption of both the AC and CC ligaments and disruption of the deltoid and trapezius fascia, with the fascia possibly being stripped off the acromion and clavicle. There's also significant tenting and prominence of the clavicle, and these types of injuries are treated surgically. Type 6 injuries, there is a complete dislocation with distal clavicle displaced inferiorly either under the acromion or coracoid. There's disruption of the AC ligaments and is associated with severe trauma, and the occurrence is rare. Type 6 injuries are treated surgically.
Due to the traumatic nature of AC joint injuries, true prevention can be difficult. To improve the prevention of AC injuries, players should wear properly fit protective equipment, keep their shoulders in the best physical condition possible, stretch regularly, and maintain good posture. Good posture can be described as maintaining square shoulders, natural spinal curves, and having a level pelvis. The musculature involved with proper shoulder mechanics are the deltoids, supra and infraspinatus, subscapularis, teres major and minor, stratus anterior, the rhomboids, trapezius, the pecs, levator scapulae, and latissimus dorsi. Proper stretching of all these muscle groups is key in maintaining normal ranges of motion and mobility of the shoulder girdle, which will further prevent the chances of an athlete sustaining an AC injury. A proper strength and stability program plays a large role in the prevention of shoulder injuries. A typical prevention program for the shoulder utilizes all planes in which the shoulder can move and is developed to include all musculature involved with movement at the shoulder. This program, as shown, does just that. Exercises such as internal and external rotations, front, side, and rear raises, the chest and overhead press, as well as the pull down, are great movements for limiting muscular instability of the shoulder and further prevent the likeliness of an AC joint injury from occurring. This concludes our presentation. We will now gladly answer any questions you have.